articles and studies, that have said that sex is a good form of exercise. So if you're talking about somebody needing to lose weight and they need to exercise for 60 minutes, to be able to do that, can you factor in the amount of time you spend having sex as part of your exercise quota?
Well, once people are consensually married and live together, sex has multiple benefits. One, it's good exercise because the whole body is going to exercise. Two, it relaxes the person. Three, it brings down a lot of the stress in the marriages and relationships. So I think I'm not endorsing that you just go around doing things that you're not supposed to do. But once you're married, it is a good way of keeping the marriage. And you remember one of our prominent writers and play, what is Ebo?
Ebo White.
He's been talking. Yeah, Ebo White has been talking about it lately. A lot of old men like listening to his story.
Okay.
Yeah, so it is true that sex helps a lot, but it has to be done in the context of you're marrying the person and then keeping the relationship going.
Okay. Doc, let me come in here. So in other words, what you're trying to say, and you're preaching, in effect, that you can have all the sex that you want, or anyone can have all the sex that she wants, but she still has to exercise.
Oh, yes. Sex is just one little bit. It's just a little bit. It doesn't contribute, assuming you're going to get exercise from, let's say you need 100% exercise per week. Sex should be like 10%. It doesn't contribute much.
Okay. Happy as well?
Yes.
Okay, Doc. So now I want to talk to you about psychological factors, that affect our hearts. Because so many times, there seems to be in our conversations a disconnect between what we think and the way we feel, and the ability that the impact that it has on our health or on our heart health, for example. So can you just clarify that for us? How much of an impact does the way we think, the things that are worrying us, the stress and the issues that we're facing in life, how much of an impact does that have on our heart health? And how is it important that we get psychological support so that we're manifesting a healthier, life physically?
Mm-hmm. Yeah, so if you look at the heart, even people who haven't studied anatomy, it's amazing. When you ask them where's their heart, they point to the left side. Okay, you go to a village, Makuma goes to the left side. So there is some psychological bearing, there is some psychological relationship. When somebody is having a heart attack, he knows that he's going to die. For some reason, the heart is able to communicate with the person. When you're in love with somebody, the heart tickles. So psychologically, there is a relationship that we have not been able to explore. Maybe it is through the hormones and blood, the adrenaline, sympathetic, parasympathetic. These are all nervous system stuff. But having said that, thinking your well-being has a bearing on your attitude, the way you think. If you think negative things are going to happen to you. If you think positive things are going to happen to you. Why is it so? There are certain hormones that are called endorphins. The more positive you are, the more you help people, the more you smile, you improve the levels of endorphins, and these have direct burden on your outlook, your energy, your heart health, your blood pressure levels. Now, negative thoughts, bad thinking, a lot of stress leads to increased cortisol, increased stress hormones, including adrenaline, which are bad for the person. So what does it lead to? Increased weight. Even though you're not eating much, you're going to be increased, your weight is going to go up. You're going to have the chance of getting to be a diabetic if you don't stop thinking bad. And then you become more depressed because the more you have bad hormones coming to you, stress hormones, the more likely you're going to be depressed. Depression is directly linked to heart conditions. So people who are depressed will try to uplift them, try to get them engaging, try to let them get out and talk more. So we have to move away. If there's something bothering you, these days we keep to ourselves a whole lot than the older people used to do. The previous generations used to have family support. You are far removed from your family and you are struggling by yourself. You need to have a community. And that is why, if you look at the World Heart Foundation, they're emphasizing the community approach, where we keep each other, we try to help each other, and then help people cope with their stress levels. At the government level, they had to come up with some strategies to help diffuse tension in Ghana whenever there's tension coming up. Whenever there is a lot of stress coming in, the government has to come out with or the Minister of Health has come out with a program that can diffuse the tension. That way, the anxiety level goes down. People will not go about destroying things because they are so anxious, and then they get injuries and stuff like that. But I think this topic is very wide, and it has a lot of psychological and cardiometabolic implication, which means that the way you think psychologically, the way you behave psychologically has a direct bearing on your cardiac and metabolism. And the metabolism aspect is the weight gain you're going to have, the increased cholesterol, increased diabetes, increased blood pressure, increased risk of sudden cardiac death, because you're going to have rhythm disturbance and then you die suddenly. But the flip coin is that if you are able to undo some of this stress, you reap a lot of benefit. And that is where we have to be emphasizing on.